Okay, now let's move on to our lecture number 5 of in our lower limb anatomy lecture series. Today we shift our focus to the foot and ankle, an area of remarkable complexity and clinical significance. So it's very important area because the foot and ankle form the foundation of weight bearing and locomotion. So their intricate structure comprising tibia, fibula, tarsals, metatarsals, and phalanges demands precise anatomical knowledge, especially when evaluating trauma, deformities, or planning radiological interventions.
Yeah, let's now examine the skeletal framework of the foot. This slide presents both lateral and dorsal views. So this helps us to understand the spatial arrangement of bones that support upright posture and dynamic movements. So tarsal bones arrangement is unlike the mobile carpal bones of the wrist. The tarsal bones are more irregularly arranged. So this configuration provides stability critical for bipedal locomotion and weight bearing. So this irregularity affects how we interpret imaging planes and plan beam entry, especially in trauma or post-operative cases. So coming to the definition of tarsus. What is the meaning of tarsus? So this term refers to the group of bones between the tibia and fibula and the metatarsals. This includes talus, calcaneus, navicular, cuboid, and cuneiforms. So understanding this region helps us identify the joint articulations and load transfer points. So this understanding is very important when assessing degenerative changes or planning immobilization. The arrangement of these bones allows for both rigidity and flexibility. This balance is essential for shock absorption, propulsion, and maintaining balance. Precise anatomical knowledge of the foot bones support accurate contourings, shielding, and dose distribution, especially when treating soft tissue tumors or evaluating post-traumatic changes. Now, let's focus on the talus and calcaneus, the two functional bones of the hind foot. Their articulation forms the subtalar joint, which plays a key role in foot mobility and stability. Talus, we can consider it as summit of the foot. The talus sits at the summit of the foot and fits snugly into ankle mortise. We already discussed how is that what is the arrangement of ankle mortise. So this talus snugly fit into ankle mortise, forming the ankle joint. This articulation is crucial for dorsiflexion and plantar flexion. So in radiological imaging, talus is often assessed for alignment, joint contiguity, and signs of avascular necrosis. So talus sit on the calcaneus. That that shows that joint we name as subtalar joint. The talus is mounted directly on the calcaneus, the heel bone. Together they form the subtalar joint, which allows inversion and eversion of the foot. Inversion and eversion of the foot. This joint is essential for adapting to uneven terrain and maintaining balance. When you are walking over an uneven terrain, so this joint make adaptations. In CT and MRI, it's a key site for evaluating hind foot injuries, arthritis, and post-surgical changes. So other bone you can see here this calcaneal bone. So we call it heel bone. So the calcaneus is the largest tarsal bone and serves as the primary weight-bearing structure of the heel. It anchors the Achilles tendon and supports the talus above. So Achilles tendon comes and attaches to the heel bone or calcaneum. So precise knowledge of the talus and calcaneus supports accurate contouring, shielding, and dose distribution, particularly in cases involving the ankle joint or heel pad. These bonds also guide interpretation of lateral foot radiographs and cross-sectional imaging. So it's helped to correlate clinical symptoms and anatomical findings. So understanding of talus and calcaneus is very important in these setups. Okay, now we'll see the structural contours of the foot, especially the lateral and medial edges. These regions are essential for understanding weight distribution and joint articulation and radiological orientation. So lateral edge is calcaneocuboid joint. So along the lateral edge of the foot, the calcaneus articulates with the cuboid via calcaneocuboid joint. This joint contributes to the lateral column of the foot, which is more rigid and supports stability during stance. So in imaging, this joint is often evaluated for alignment, degenerative changes, and post-traumatic disruption, especially in lateral beam entry or when assessing foot fractures. So now we'll go to the medial edge. So it's an elevated arch structure. The medial edge of the foot is raised off the floor by four bones. So what are they? The talus, navicular, and tricuneiforms. This elevated structure forms the medial longitudinal arch critical for shock absorbent and dynamic movements. So the talonavicular joint plays a central role in this arch. Talonavicular joint plays central role in this medial arch. It's allowing flexibility and distribution forces during gait. So these anatomical relationships guide how we interpret the foot alignment, assess joint congruity, and plan therapeutic interventions, whether evaluating trauma, arthritis, or congenital deformities. So precise knowledge of these edges supports accurate imaging and treatment planning. Next important topic is the arches of the foot. The arrangement of the tarsal bone ensures that the body weight is transmitted in an even manner. So usually the talus transmit weight through itself to two bony pillars, two rays. So now we'll go in the next slide. What are these pillars? What are these rays? Okay, now we'll see the arches of foot closely. A biomechanical marvel that supports weight distribution, shock absorption, and dynamic movement. The structure is not only vital for function but also for interpreting imaging and planning and therapeutic interventions. So we'll see the tarsal alignment and weight transmission. The arrangement of tarsal bones ensures that body weight is transmitted evenly across the foot. This stability is essential for upright bipedal locomotion and is reflected in both static and dynamic imaging. So we can think talus as a keystone of the arch. The talus plays a central role. It transmits weight through itself to two bony pillars or rays that rest on the ground. This design mimics the keystones of Roman arch, locking the structure in place and maintaining integrity. This concept is especially useful when evaluating midfoot collapse, flat foot deformities, or post-traumatic misalignment in radiographs and CT scans. Precise knowledge of the arch supports accurate contouring and beam placement, particularly when treating soft tissue lesions or evaluating post-surgical or post-reconstructive patient. Yeah, so now you can see this arrangement. This is our medial longitudinal arch and this is our lateral ray. So posterior ray is made by the calcaneus and anterior ray is made by navicular bone and tricuneiforms. The arch formed is medial longitudinal arch of the foot. So in this is we call medial longitudinal arch. So when we go to the lateral ray of the foot is composed of cuboid bone, fourth and fifth metatarsals. So they lies in gentle contact with the ground on standing as no arch here. It looks much better. Lateral ray doesn't bear much weight, only briefly when walking, so it's more important for balance. So these are the four important joints to consider in the tarsal region. So ankle joint, subtalar joint, talonavicular joint, and talocalcaneocubic joint. Now we will see the subtalar and tarsal joints, two critical articulations that govern foot mobility, stability, and load distribution. Their complex structure is essential for interpreting imaging and guiding the therapeutic decision. So this understanding of this structure is very important. First joint we'll see closely is subtalar joint. It has a ball and socket configuration. So the subtalar joint lies between the talus and calcaneus, though traditionally described as a plain joint. Its three articular facets give it a ball and socket-like behavior, allowing movement like inversion and eversion of the foot. It consists of two talocalcaneal joints with two and one facet respectively, and talonavicular joint. These articulations work together to absorb rotational forces and adapt to uneven terrain. So this is the joint make the adaptation when you are walking over uneven terrains. Next we'll go to the metatarsal joint. The metatarsal joint includes the calcaneocuboid joint you can see here, and the talonavicular joint. So, and the talonavicular part of the talocalcaneonavicular joints. So, talonavicular part of the talocalcaneonavicular joint. Together, they allow the forefoot to adapt independently from the hind foot. So, this is the marvel of the architecture. This flexibility is crucial for gait and shock absorption. So, this flexibility helps to maintain gait and also to absorb the shock during our gait cycle. So, we have put the color code for the clarity, not the color coded labels. Green, green for talocalcaneal joints, purple for talonavicular, blue for calcaneocubic, and red for the talocalcaneonavicular complex. This helps us visually separate functional units and understand their biomechanical roles. You can see we have put in different colors so you can identify easily these joints.